I'm just going to inspect your posterior exam. Okay, skin color is evenly distributed, no lesions or bruises. Temperature is even throughout. Perfect. Next thing I'm going to do is palpate your skin. Any pain or tenderness back here?
No.
No? Okay, perfect. I'm going to palpate through your spinous process and paravertebral muscles all the way down. Perfect. Any pain with that?
No.
No pain or tenderness noted. No deviations. Spinous process is midline. No masses, bulges, or any deformities noted. The next thing I'm going to do is take a listen to your lungs. Okay. Deep breath in and out, and in, 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 and out. Okay, perfect. Now I'm going to do some percussions. Percussion, no dullness noted, tympanic throughout. I'm just going to test for CVA tenderness now. Any tenderness there with that?
Nope.
Okay, perfect. And AP diameter is 1 to 2. I believe that's it for my posterior exam. Sit back down and actually lay back like I originally was going to have you do. Okay. Now I'm going to do your interior exam, and I'm going to pull this blanket up just to give you some privacy. Okay. And then I'm going to lift your shirt up. Is that okay?
Yes.
Okay. Okay. Interior chest hair present, color evenly distributed throughout, evenly distribution with color, no bruises, lesions, or masses noted. I'm going to take a listen. Deep breath in and out, and in, and out, and in, and out, and in, and out, in, and out, in, and out, in, and out, and in, and out. Perfect. Okay. Breath sounds were clear throughout on anterior and posterior chest. Next thing I do want to look at is I'm looking for retractions. Breathing appears effortless, smooth, regular rate, no retractions or bulges noted. All right, next thing I'm gonna do is your cardiac assessment. So I'm just going to lift your shirt up again, pull this blanket up for privacy. Alrighty, first thing I'm gonna do is just inspect and palpate. I'm gonna palpate for your PMI in the 5th intercostal space, midclavicular. PMI is 2+, regular smooth rate. Okay, perfect. Now I'm gonna take a listen to all your heart sounds. There'll be 5 points. Okay, first I'm going to listen to your aortic at the 2nd intercostal space, right side at the sternal border. Now your pulmonic 2nd intercostal sternal border on the left side. Then your Erb's point. On your tricuspid, the 4th left intercostal space, the sternal border. And your mitral, the 5th left intercostal space, sternal border. Okay. I'm going to also take your apical heart rate for 1 minute. Hot. Okay. Ready. About 30 seconds left. Okay. All right, and then I'm just going to listen for bruits real quick in all those same spots. Okay. All right. Apical pulse heart rate is 80 beats per minute with a regular smooth rate and rhythm. S1, S2 is noted through all 5 heart sound locations, and there were no bruits, leaves, hits, or thrills noted. So that's it for your cardiac exam. I'm going to move on to your abdomen. So I'm going to just lift your shirt up again. About right there is okay. If you can slightly bend your knees up, perfect. That's good right there. Are you comfortable?
Yes.
Okay, awesome. I'm just going to look at your skin. Abdomen is smooth, skin color evenly distributed, no lesions, bruises noted, hair throughout, umbilicus is midline, temperature is even throughout. Okay, next thing I'm going to, also no pulsations or movements noted. Now I'm going to listen to your bowel sounds. Bowel sounds present in all 4 quadrants. If you don't mind just keeping your knees bent still a little, just slightly. I'm going to listen. Heart sounds present at the aorta, no bruit noted. Sounds noted at the renal artery, and then I'm just going to put here at your femoral artery. Okay, 2 plus amplitude at the femoral artery. No bruits noted. Okay, now I'm going to palpate your abdomen. I just want you to tell me if there's any tenderness or pain with this, okay?
Okay.
Okay. This is just a light palpation. Any pain or tenderness? Okay.
No.
Okay, now I'm going to do a deep palpation, it's a little firmer. Any pain or tenderness with that? Okay, now I'm going to do rebound. I'm going to push in. Any pain or tenderness with that? Okay, perfect. No masses or deformities noted on light palpation, deep palpation, and no rebound tenderness present. No pain on light or deep palpation. I'm going to percuss. All quadrant tympanic on percussion. I'm going to palpate your liver at the right costal margin. Liver is non-palpable. Any pain with that? Okay, perfect. All right. Just make sure run through my head, make sure I didn't forget anything with the abdomen. I believe that is it with the abdomen. Now I'd like to look at your lower extremities. Color is evenly distributed, no lesions, there's hair on the legs, temperature is warm throughout. Can you feel my touch?
Yes.
Okay, perfect. Wiggle your toes for me. I'm just going to do cap refill check. Okay, cap refills less than 3 seconds in all toes. Nail beds are at a 160-degree angle. And I'm going to feel your pulses on your feet. All right, dorsalis pedal pulses are 2+, regular rate, smooth. Okay, PT pulses are 2+, regular rate, smooth. And then okay, 2+ and smooth, regular rate. Next thing I realized I forgot with your abdomen is I just want to do an assessment for a hernia. So if you can bring your knees up, and then I'm going to lift your shirt up, and if you can bring your neck forward, like your head. Yep, okay. No hernia present or noted. And then at this point, I would talk to you, and out of dignity, we won't be performing the male testes exam, but I would talk to you about that. What I would do is I would inspect the penis scrotum. I would also palpate the penis and inspect the urethral meatus based off the location. I would assess for discharge. And then I would also palpate the testes and epididymis and the vas deferens. As well as you should be doing this as well at home and assessing for any masses or deformities or anything. You should do this in the mirror at home, and you should do it once a month in the shower, and again, just make sure you're in front of a mirror. For the female, I would do the same type of education. I would tell them to inspect in the morning, after their period, in the shower, monthly, and they should do it lying down with their arm up. I would be inspecting size and symmetry of the nipple and areola, and I would also be palpating all the quadrants of the breast, the tail of Spence, and the nipple. And as well as I would be looking for masses and deformities. And I believe that is it for this exam. Thank you so much.
Thank you.